Hey guys, if you feel like you're being limited by your squat, feeling like you can't go down low enough, or maybe you're not getting enough strength and or you're having pain in either your knees, your low back, or even sometimes your ankles or your hip, this is going to be a really important episode for you guys. My name is Dr. Antonio with Loud Chiropractic and Coaching here in Lafayette, Colorado. Now, today what we're going to be talking about is why everyone should have a different squat stance. If we know that you and I have a different body type, why should we be squatting the same way? But yet in our fitness classes, whether that be CrossFit, Orange Theory, and we're not picking on those, these are just off the top of our head. It could be a boot camp nonetheless, the same. We're told to squat hip width apart and with your toes facing straight. And it's been like that for a while, but yet it's still the norm of how a squat is being coached. Yet there are nuances how people talk about torquing in and creating torque to hopefully create more space, but that doesn't help if your anatomy doesn't line up with that stance. So here's what you need to do. Here's what you need to know and understand. We're going to go through a little bit of anatomy training really quick here just to show why you should be considering the different squat stance and a couple different things that you can do to determine what your perfect squat stance is. Okay, so what we have here, here's our spine, right? So we have a spine model here. Underneath the spine, we have our pelvis. The pelvis and the spine attached back here on the sacrum. Now, the important part to note is this is a unit. The pelvis moves as a unit. When we're walking, there is a little bit of rocking back and forth in the pelvis, but this moves as a unit. Where we're going to see more movement is from the ball and socket joint itself, but you're also going to see more movement here. Because this articulates as a unit, the lower back, L4, L3, L5-ish area down here, you tend to see hinge points created as a result of what's actually happening. But what we want to zoom in here on is the actual ball and socket joint. So we see the ball and socket joint here. It's a nice, big, greasy joint that should move a lot. The sheer makeup of what a ball and socket joint means is movement, right? It can pivot, it can twist, it can go through all sorts of ranges of motion. Now, what we also have to consider is this has a whole lower extremity here. The femur attaches to the tibia through the knee joint and then down into the foot. So the position of the foot, because of that, is going to change the articulation of the hip joint. And the space that my feet are apart from each other, depending on the activity or the movement, will also determine how much this is moving. But let's zoom in here a little bit more. So what you have to understand is we have two sides of the joint. You have the ball and then the socket. The socket is going to be differently shaped for different people. For some individuals, you can see how this is kind of down and to the side. For some individuals, this might be down and slightly forward. Or it might be slightly angled higher and out and up. Now, it doesn't change all that drastic because obviously the leg still has to go down, but we're more so looking at the exact shape of what this is. Now, the shape of this determines how the head or the femur, the head of the femur, actually fits in there. Now, what you'll also see is the femur can have retro or antroversion, meaning the positioning of the actual head could be slightly forward or slightly back. And then that will also determine how the rest of the leg is oriented in relationship to the pelvis based on what that orientation is. So you're going to see already off the bat, we're talking about two basic variations that will determine or will create a much different stance and position compared to you and I on what that looks like. Now we can also see that the actual depth of the socket might also be different. So the depth meaning how deep is this acetabular rim compared to others. For some people, they have a very shallow rim, which means the range of motion, because the rim is not that deep, the range of motion they can express is a lot higher. For other individuals, they might actually have a deep rim, which means they're not going to be able to express as much hip range of motion because you're going to start running bone on bone. Okay, so what we're going to see here is how do these two joints again move in relationship to each other. So this would be hip flexion. Obviously, this would be if I'm just standing here, the hip flexes up when you walk. it swings back behind you. It can also internally, externally rotate a little bit. And then there's any combination of that. Abduction would be me like bringing my leg out to the side, right, as such. And then with that, you can combine all those. Now, when we're going into a squat, that's going to be expressing a really deep amount of hip flexion. Now, right off the bat, so notice how the femur is facing straight down. As I start to bring this up into flexion, where does it go? You can already see that angle, right, has changed. It's starting to swing outward. So as you're going through various ranges of motion based on how the socket is shaped, it's going to change the position of the femur. So if you are putting yourself in a box, or the coach is putting yourself in a box saying hip width apart and feet straight, you're probably going to be running into some issues. Okay? Now, what issues are those? Commonly, you're going to see, right, the hip flexion. This bone is going to start rubbing up against this bone. If I'm not in the proper orientation, notice how it wanting to go out. If I'm forcing it to go straight up, I'm going to start rubbing that joint in an unnatural way that the joint was not set up for. So oftentimes you'll get individuals complaining of a pinch deep in your hip with that deep flexion or the deep part of the squat. That's because that bone is rubbing up on either the acetabulum or the labrum. Now, what might also happen, Dr. Ryan DeBell and Dr. Stuart McGill, who have studied and presented a number of articles and topics on this, what typically is going to happen is your body is going to start to realize you're running out of space here, and so you're going to tilt your pelvis upward, which is that classic butt wink or dumping of the low back. And when you do that, the pelvis rotates upward. You've now changed the position of the acetabulum to kind of scoop out and up to give you more hip range of motion. So by doing the butt wink, I actually tilt the pelvis underneath, and now I can actually get a lot more hip flexion. So is the butt wink bad? It depends on the context. If you're under a lot of load, ideally we don't want to be dumping that lower back or tucking the pelvis a lot. But if you're going to the bathroom in the woods, if you're sitting on the floor playing with your kids or eating a meal, it is completely fine to be in that position. And it's advantageous in that context and in that scenario. So take that in consideration. But under load, if I'm trying to maintain this neutral lumbar spine and I start tucking the pelvis, see how that lower back starts to flex? So now I'm under compression because I have weight on me and I'm moving the spine. Those are the two scenarios that we do not want that tends to lead to a potential injury, right? Now, many will argue that is not true, or we don't know that to be 100% true, but ask anyone, do you want to flex your back when lifting? The unanimous answer is going to be no. And it doesn't take a lot. If I'm under load and I'm just buckling just a little bit, I'm going to see, because again, the pelvis moves as a unit, that motion segment's going to come from this lower back here. It's not going to be the pelvis. So when people usually complain about lower back pain right around here after squatting, many people say it's going to be an SI joint because they're pointing close to the SI. But consider the L5, S1, that motion segment's right there. L4, L5 is right there as well. And again, if that pelvis is moving as a unit, you're not going to typically see SI joint dysfunction. It's typically going to be a lumbar derangement or some sort of lumbar issue. So backing up, what you're going to see now in this next video clip is how we assess what your shape, what your anatomical makeup actually looks like to help give us an idea of where you should be squatting. So pay close attention to this. This is something that you can do on your own, laying on your back by simply scouring your hip. This is called the hip scour. So watch this short clip here. All right, so when going through a squat assessment to determine stance, we want to look at A, what they're first doing, and then B, we can post-test after the example of showing like a hip scour. So what Nichelle's going to do is she's going to show what's commonly coached and cued, which is hip or feet width apart, hip or shoulder width apart, and toes straight. So when she squats down, you see a front angle here, right? She gets to about there, and because you see the top of her head, right, she's got that pitch forward torso lean. From a side view, very similar, right? So what gets coach now, if she does a couple more, coach is like, lift your chest. Let me see if you had a name on your chest, right? Which forces her to hyperextend. Now, what we can determine next is trying to figure out what her ideal squat stance is by doing a hip scour. So you can do this by yourself, but we're going to show. So Nichelle's going to lay on the table here. I'm going to move this around so you guys can see. On your back, please. All right, so what we're doing is we're trying to show from this angle, ideally width, okay? And I'll turn it here in a second so you can see a different angle from it. But if you're going foot width apart where she was, or hip width apart with toes straight, I'm controlling this and I'm trying to determine what the shape of our hip is. So when I come up in this narrow angle, I can already start to meet some resistance where her hip and her acetabulum meet, right? So as I come up, I feel that block, but I'm not going to hold it and I'm going to let it dive out. So as this dives out, you can see now where her foot lands and her shoulder being here, it's well outside what her hip and her shoulder width would be. Now from here, you can also play around with what foot angle would be so that you can kind of get a representation of how much torque or resistance there is if she's trying to keep it straight or if she's trying to keep it out or point it outwards. So from a side view, see if we can get this here. You're gonna also look at how deep her hip goes. So from here, the reason why she was pitching forward is when we bring her up, her hip basically runs out of space up at the hip crease where the femur actually meets the acetabulum or the ball and socket. So if she was to go narrow, it would make sense that she'd run out of space. And she's about 90 degrees, maybe needs slightly above. But if we let this go and pass it, now she's well above what that 90-degree angle would be as far as depth. So you can see it on this side as well, as if we bring this up, that's when we start to meet that resistance. And then if we let it dive out, she gets obviously much deeper. She's at about lower sternum angle with that wider position. So if she stands back up, I'm going to bring this back around. Okay, so now we'll just kind of do a representation again. Let's go narrow and face that way. So narrow facing that way, right? If she squats down, we see where it pinches right here and she gets stuck. Okay, so if she goes wider into that position, feet open, toes are open too, and she goes down, automatically she's able to hit the exact same depth, if not deeper, in maintaining a longer spine and more upright torso. So when she faces you now, yep, so we'll go narrow, kind of representate where we were before, pinched off in the front, pitched forward with the torso, wider angle. Now she's able to go down a lot easier and maintain more of an upright torso. So two factors that all we're trying to figure out is what the width is and what your toe angle is. Even though the hip scour is more directed towards showing what the hip architecture looks like so that you can find that opening position, you still have to play with foot flare with that width to determine what works best for you and your anatomy and the type of squatting that you're trying to do. All right, perfect. So what you saw in that previous clip, that was my wife, Nichelle. We just went through a very basic kind of hip scour to show you where her hip socket was the deepest. So when you bring the knee up, if you bring it in this narrow midline area, you're gonna run into that bone and bone position that we talked about. So same thing here. If I keep that hip in that front, in that sagittal plane, I run out of space here. But if I allow it to go and just scour and follow where the hip wants to take me, oftentimes you're gonna see that hip pop way out here, and what's also gonna happen is you're gonna get into a deeper position. So if you're being coached to go deeper and you're narrow, it's probably not gonna happen. You're gonna run into those issues. So backing up once again, there are a couple of things that you need to try. There's two, we're gonna start with this. When you're squatting, two main rules. Don't let your feet move. Try to maintain a long neutral spine throughout the majority of the movement. Will there be a little bit of lumbar motion? Potentially, right? But we're trying to manage that as best as we can, and by expressing more hip range of motion, you're going to reduce the amount of lumbar or low back movement. So now you play with two different knobs, two different dials, and you're going to try both of them at the same time to determine what is going to be the most ideal position for you. Now, As a sidebar, if you're having pain right now, we're not going to get the best assessment of judgment, but that's okay. This will still be highly beneficial for you, okay? You are going to play with width of your feet and angle of your toes. So if I stand back here, and I'm going to show you from a side angle real quick. Let me move this just so it's not limiting me. I'm going to show you from a side angle. If I'm in a narrow stance, hip width, toes straight, I get to here and I feel a block. I am forcing myself to go lower, but my hips are blocking me from doing so. My hip is running, or my femur is running into the acetabulum. I cannot go lower. So if I'm in class and coach is telling me to go lower, or you're trying to just personally go lower, in order to go lower, I have to dump my low back, and now I can get lower. Not under weight, not under load, not for high repetitions, that might be fine. But if I've changed my stance, now I can easily go lower without compromising my low back by expressing more hip range of motion and doing a really nice squat. It's almost effortless. When you find the right position, your body and your mind should go, oh, that was easy. You shouldn't need to force yourself into the depth. You should be able to just line up everything so that you can drop in and use each range of motion from each joint as needed and just complete the task. So again, you're gonna play with, if I start here, all right, that's too narrow. I feel blocked. Toes straight still. Let's just turn one dial at a time. All right, that's better. I can go lower, but now I feel a ton of torque in my knees because my hips want to go out, but yet my toes are facing straight, right? The knee's in the middle. It's almost like a towel being twisted. So that's not ideal. So let's bring it in a little bit, but yet turn out. All right, cool. We're getting there. I feel it's a little bit smoother, but not quite there. So now I'm just going to start playing around with, okay, that's too wide with my feet. That's sweet. That's my good spot. So I can practice this. Body weight, I can use a suspension trainer to help kind of guide me. And then I want to get under some load. I want to start programming this and patterning it so that my body is used to feeling strong and moving in that position. But it's a simple setup, and it makes the world of difference, especially for those who are dealing with a pinch in the front of their hips. They're just jamming that. If you're dealing with lower back pain, because no matter at your best efforts of trying to keep your spine nice and long, once you get to here, you just dump, it's not going to change. You can't hold that position if you're running into a roadblock. You're always going to end up sacrificing one or the other. So easy fixes here. Play with width, play with angle, and it will make all the difference in how you squat, especially if you're dealing with pain. So refer back to the hip scour, again, something that you can do on your own. If you're unsure how to do it, we can do a simple, easy video assessment and from just watching you do a couple repetitions, be able to guide you in the right direction. So if you're interested in that, please feel reach out to us. If you know someone who's struggling with the squat, because we see it in the class, we hear about it from our patients and our clients, send them this video. If a coach, this might be a little bit tougher, but if a coach is still coaching this way, please share this with them because it makes such a world of difference in not only the strength that you can express, but also the potential to reduce injuries and deal with pain if you're dealing with them. Thanks for tuning in, guys. Once again, my name is Dr. Antonio with Live Loud Chiropractic and Coaching. I hope that this video brought you extreme amounts of value for your fitness and for your health. Be sure to subscribe to the YouTube channel so that you can keep up with all the videos that are coming through. Be sure to check out our website, liveloudlife.com, where we have podcast episodes and other forms of content that I know will be super valuable to you. Until next time, guys, live loud.